There is no other hospital in the US at least that does more neuroblastoma than CHOP. They see the most volume than any, so we decided to also go interview the doctors over there. And as soon as we've completed the interview, we knew we wanted to take them to Philadelphia.
For a child and for a family facing cancer, we have every surgical resource imaginable at the Children's Hospital of Philadelphia. When you think about it, we have an array of pediatric surgical specialists, 75 in number, more than any center in the world that can provide any expertise that a child with cancer needs.
The nice thing about a place like CHOP is that we have experts in really just about every area of pediatric subspecialty. And so if patients come with a problem that is unusual or uncommon, we know that we can find the expertise.
I can think of 8 to 10 different techniques that we've developed here in response to challenging situations or problems. The whole field of limb-sparing surgery has been around for a long time, but within the umbrella of that field there are many different nuances and variations that have been developed here at CHOP over the years.
The right approach to surgery on the brain is a little bit different than other surgeries because the function is not quite as well defined, the whole mind-brain barrier. So the great concern is always to be aggressive without being reckless. You want to remove as much tumor as you can and leaving them neurologically intact.
The majority of patients with neuroblastoma eventually require surgery. Surgery is an integral part of the care of most patients with neuroblastoma. Most of the time is spent painstakingly removing the tumor, literally millimeter by millimeter. And sometimes it means separating it very carefully from these very delicate structures. We always have to take our time and be very careful.
A surgeon has to have a great deal of technical expertise in order to be able to carry out, for example, a limb salvage procedure. I think what sets the team at CHOP apart is an ability to understand the chemotherapy, the radiation considerations, and all the other aspects that go into the entirety of a patient's care. Patients come from a very long way to take advantage of the expertise and the volume that we have here at CHOP.
Volume is critical in a surgical program for the simple reason that the more experience somebody has in all the varieties of a clinical presentation, the better off the patient is going to be in terms of that surgeon's being able to anticipate as well as to deal with the unexpected. If you're doing 100 operations for brain tumors a year, the variety and the differences of clinical experience that you're going to have and be able to bring to this individual patient is going to be much richer and much more powerful.
The fact that we see so many children with rare, uncommon, difficult tumors, I think leads to this, or helps foster, support this environment of innovation, trying to find new and better ways.
For most patients and parents whose child is about to undergo a major operation under general anesthesia, it's often the anesthesia that is the scariest part for those patients. And so we try to address that in a proactive way ahead of time. We reassure them that general anesthesia is very safe for patients, especially young patients. But we also reassure them that it is a very serious business.
We're fortunate to have an anesthesia pain program here at CHOP, which I believe is very unique and hugely valuable after this type of surgery. Our anesthesia team is looking for catheters or regional blocks or post-operative pain management techniques that will help make it a less painful experience for the child after surgery.